Hi everyone. In today's clip, I will talk a little bit about sciatica issues. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So sciatica refers to pain that travels along the path of the sciatic nerve. The sciatic nerve travels from the buttocks and down each leg. Sciatica most often happens when a herniated disc or an overgrowth of bone puts pressure on the lumbar spine nerve roots. So this happens upstream from the sciatic nerve. This causes inflammation, pain, and often numbness in the affected leg. So although the pain associated with sciatica can be serious, those cases that are caused by a herniated disc can clear up with treatment in a few weeks or months. People who have severe sciatica and serious leg weakness or bowel or bladder changes might need surgery. Sciatica pain can be almost anywhere along the nerve pathway. It's especially likely to follow a path from the lower back to the buttocks and the back of the thigh and calf. The pain can vary from mild ache to sharp burning pain. Sometimes it feels like a jolt or electric shock. It can be worse when coughing or sneezing or sitting for a long time. Usually sciatica affects only one side of the body. So some people also have numbness, tingling, or muscle weakness in the legs or feet. One part of the leg can be in pain, and while other parts can be actually feeling numb. So sciatic issues can have different root causes, from obesity to occupation to prolonged sitting or even diabetes. Most people recover fully from sciatica, as I mentioned, caused by herniated disc, often without treatment. But sciatica can damage nerves. Make sure to consult your healthcare practitioner if you experience loss of feeling or weakness in the affected leg or loss of bowel or bladder control. To prevent it, exercise regularly to help to sort of keep the back strong, work the core muscles, the muscles in the abdomen and lower back that are needed for good posture and alignment. Keep good posture when sitting. Choose a seat with a good lower back support, armrests, and a swivel base. For better low back support, you can even place a pillow or a rolled towel in the small of your back to keep its normal curve. Keep the knees and hips most of the time at the same level. Use your body correctly. For example, when standing for a long period of time, rest one foot on a stool or a small box from time to time. When lifting something heavy, let your legs do the work. Hold the load close to your body and don't lift and twist at the same time. Vitamin B6, ferolic acid, and some supplements that may help with sciatica include alpha-lipoic acid, acetyl L-carnitine, rosehip, vitamin D, resveratrol, and myrrh. Sciatica is a classic condition of lopsidedness. On some level, the pelvis, which is in many ways the center of gravity and the center of steadiness in movement in the body, is out of balance. One side is too tight, while the other side is being pulled open, sort of. Metaphysically, what might this sort of imbalance be relating to in your body? You might want to try sort of ask yourself some questions related to the spiritual meaning of sciatica and see what comes up for you. Let's say, for example, what in my life feels out of balance right now? Am I happy with the direction I'm going? Or or does part of me want to turn away to move in another direction? Do I feel that I have freedom of movement in my life? Freedom to speak, to change my mind, to do as I wish? Whether the sciatic shows up on the right or left side of the body may mean different things. The left side where there is pain, the side where there is pain is tightened, compressed, and constricted. That means the other side is being pulled open. Sometimes the energy is unbalanced on the too open side, but in general, you'll want to look at the side where there is pain. So the right side of the body is the masculine half, which is relating to yang energy. This is the energy of taking action, getting things done, thinking rationally, and emotions like anger and frustration. There also may be a message here about a male or masculine person in our lives, such as husband or boyfriend or father or son. Here are some things that you can think about for the right side sciatica. For example, we can think about, what is my relationship to my anger like right now? What is it like right now? Am I getting the things done, or is my progress feeling frustrated? How do I relate to the masculine aspect of myself? What is happening with the close people in my life who are male or masculine? So the left half of the body represents more of a feminine or yin aspect of things. This relates to our intuition, our emotional and rational selves, our bodies, and emotions like sadness and grief. Here, we may also want to check with how we are relating to close female or feminine people in our lives, such as our mothers, girlfriends, wives, or daughters. And we may ask things like, how am I relating to grief or sadness in my life right now? Am I feeling connected and safe in my close relationships? How connected do I feel to my own intuition, emotion, or spirituality? What am I feeling around the more feminine aspects of myself? What is happening in my life with the female or feminine people I am close to? So sciatic issues come up very often in pregnancy, especially late pregnancy. This is an obvious enough sort of connection because of the weight of the baby pulls the belly forward and causing imbalances in the pelvis. The baby is sometimes also literally sitting on the sciatic nerve, causing this pain. This will generally go away after giving birth, but there are still some important questions that you might want to sort of consider about pregnancy and sciatica. Things like, do I feel fully supported in my pregnancy and motherhood journey? How do I feel about the spiritual weight of responsibility over the child in my belly? How will I maintain or create peace for myself, my sensual, creative expression, while also managing the life with this child? How can I explore the concept of balance in my own life, especially having given birth and now with a newborn? Inevitably, things will be out of balance, basically unbalanced for some time. So how can I work back towards that? So sciatica is absolutely treatable, often with physical movement interventions, but it might be worth taking some time to consider the spiritual meaning of sciatica as you explore healing and balance your body, mind, and spirit. Hope this has been helpful. Like and follow for more. Be the light.